Cyclothymic disorder is an mood disorder, mental health issue. Look at this picture shows that irritable moods and other symptoms. Detail going on. Introduction. Cyclothymic disorder, also known as cyclothymia, is an chronic mood disorder characterized by fluctuating low level depressive symptoms and periods of hypomanic symptoms. It is considered a milder but more chronic form of bipolar disorder, despite its relatively mild symptoms compared to full blown bipolar 1 or 2 disorder. It can significantly impair functioning and quality of life. Definition. Cyclothymic disorder is defined as a mood disorder involving repeated mood swings between hypomania and mild depression without meeting the full criteria for either major depressive episodes or manic episodes. These fluctuations persist for at least 2 years in adults, 1 year in children or adolescents. Etymology. The term cyclothymic comes from the Greek words hyklos, meaning circle or cycle, and thymos, meaning spirit or mood, reflecting the cyclical nature of mood changes in the disorder. It was first introduced in the late 19th century to describe individuals with chronic fluctuating mood disturbances that did not meet the criteria for manic depressive illness. Epidemiology. Cyclothymic disorder affects approximately 0.4% to 1% of the general population, with equal prevalence among men and women, though men are more likely to present with hypomanic symptoms and women with depressive symptoms. This disorder begins in adolescence or early adulthood and is frequently underdiagnosed or misdiagnosed due to its subtle and fluctuating nature. Types. Cyclothymic disorder is not formally categorized into subtypes by DSM-5, but clinically variations may include 1. Cyclothymia with predominant hypomanic symptoms. 2. Cyclothymia with predominant depressive symptoms. 3. Rapid cycling cyclothymia, frequent fluctuation in mood. 4. Subthreshold cyclothymia does not fully meet duration or severity criteria but but has significant clinical relevance. Causes. The exact cause is unknown, but several factors contribute. 1. Genetic predisposition. 2. Neurochemical imbalances. Example serotonin, dopamine. 3. Structural brain abnormalities. 4. Environmental stressors. 5. Childhood trauma or abuse. 6. Psychosocial stress and lifestyle factors. Risk factors. 1. Family history of bipolar disorder or other mood disorders. 2. Personal history of mental health conditions. 3. High stress environments. 4. Early childhood trauma or neglect. 5. Substance abuse. 6. Poor social support systems. Complications. If left untreated, cyclothymic disorder can lead to 1. Development of bipolar 1 and 2 disorder. 2. Impaired interpersonal relationships. 3. Occupational or academic difficulties. 4. Substance abuse. 5. Risk of self-harm or suicide. 6. Poor quality of life. Pathophysiology. Pathophysiology of cyclothymic disorder step by step. 1. Genetic predisposition. Individuals may inherit genes associated with mood regulation abnormalities. Family history of mood disorders, especially bipolar disorder, increases susceptibility. 2. Neurotransmitter dysregulation. Imbalance in key neurotransmitters, especially serotonin, dopamine, and norepinephrine. These neurotransmitters regulate mood, arousal, and emotional responses. Low serotonin may contribute to depressive symptoms. High dopamine or norepinephrine may lead to hypomanic symptoms. 3. Hypothalamic pituitary adrenal axis dysfunction. Chronic stress or genetic vulnerabilities cause dysregulation of the HB axis. Results in abnormal cortisol levels affecting stress response and mood stability. 4. Limbic system abnormalities. Functional changes in brain regions such as the amygdala, hippocampus, and prefrontal cortex. These areas are involved in emotion, processing, memory, and impulse control. Irregular activity can cause mood swings and affect behavior regulation. 5. Disrupted circadian rhythms. Alterations in biological sleep wake cycles and daily hormonal rhythms. Leads to fluctuation in energy, alertness, and mood throughout the day. 6. Environmental triggers, stressful life events, trauma, or substance use may activate or worsen underlying neurobiological instability. These triggers can intensify mood shifts and interfere with emotional regulation. 7. Chronic mood instability. The combination of these factors results in alternating period of hypomanic and depressive symptoms. These do not meet the full criteria for a bipolar disorder but are persistent and impair daily life over time. Signs and symptoms. A. Hypomanic symptoms. 1. Elevated or irritable mood. 2. Increased self-esteem or grandiosity. 3. Decreased need for sleep. 4. Increased talkativeness. 5. Racing thoughts. 6. Distractibility. 7. Increased goal directed activity or risky behavior. B. Depressive symptoms. 1. Sadness or hopelessness. 2. Fatigue or low energy. 3. Low self esteem. 4. Sleep disturbances. 5. Poor concentration. 6. Feeling of worthlessness. 7. Social withdrawal. Note: symptoms are present for at least 50% of the time over 2 years without being symptom free for more than 2 months. Diagnosis. A. Clinical evaluation. 1. Psychiatric assessment. 2. Personal and family history. 3. Mood charts tracking mood over time. B. DSM-5 criteria. 1. At least 2 years. 1 year in children of numerous periods of hypomanic and depressive symptoms. 2. Symptoms do not meet full criteria for hypomanic, manic, or major depressive episodes. 3. Not better explained by other mental or medical conditions. C. Additional tools. 1. Mood disorder questionnaire MDQ. 2. Hamilton depression rating scale. 3. Young mania rating scale. Nursing diagnosis. 1. Risk for self directed violence related to mood instability. 2. Impaired social interaction related to fluctuating moods. 3. Ineffective coping mechanisms related to emotional instability. 4. Disturbed sleep pattern related to hypomania or depression. 5. Chronic low esteem related to persistent mood disturbances. Medical management. 1. Mood stabilizers, lithium, valproate, lamiotrigine. 2. Antidepressants with caution. 3. Atypical antipsychiatric, olanzapine, quetiapine. 4. Psychotherapy, CBT, IBT, and psychoeducation. 5. Monitoring, regular psychiatric follow-ups and mood charting. Nursing management. 1. Monitor mood and behavior changes. 2. Promote adherence to medication. 3. Educate about early warning signs of relapse. 4. Encourage participation in structured activities. 5. Provide emotional support and active listening. 6. Ensure a safe environment in cases of self harm risk. Treatment options. 1. Pharmacotherapy, mood stabilizers, antipsychotics, courteous use of antidepressants. 2. Psychotherapy, cognitive behavioral therapy CBT, interpersonal and social rhythm therapy IPSRT. Psychoeducation. 3. Lifestyle modifications, regular sleep patterns, stress management, avoiding alcohol or drugs. 4. Support groups. 5. Family therapy to improve understanding and reduce stigma. Psychosocial medicine. 1. Psychoeducation, educate patients and families about the nature of the disorder and coping strategies. 2. Cognitive behavioral therapy CBT to identify and correct distracted thinking and behaviors. 3. Family focused therapy improves communication, reduces stress in family relationships. 4. Social skills training helps rebuild relationship and improve social interaction. 5. Occupational therapy to promote productivity and adapt to workplace challenges. Prevention. 1. Early recognition and treatment of mood fluctuations. 2. Regular psychiatric evaluation for those at genetic risk. 3. Healthy lifestyle, sleep, diet, exercise. 4. Stress reduction techniques, yoga, mindfulness. 5. Avoiding substance use. 6. Support networks, and access to mental health services. In conclusion, cyclothymic disorder is a chronic mood condition that may be overshadowed by more severe bipolar disorders but can be equally disruptive. Early recognition, appropriate medical and psychosocial interventions, and ongoing support are essential to managing symptoms and improving quality of life. Raising awareness and reducing stigma and significantly improve outcomes for individuals living with cyclothymia. Thank you. Have a nice day.